Okay, so in this section of the course, I'm going to go over nutraceutical applications to infertility. I'm going to go over the literature and the science for you of how these nutraceuticals impact fertility. So far we went over the pathophysiology of infertility, we went over the web, which are risk factors, and then went into diet, nutrition, and lifestyle strategies for the most common patterns of infertility. What I want to do now is go over the nutraceutical approaches. So my academic goal is to really review the peer-reviewed literature for you as related to nutraceuticals, and my clinical goal for you is to help develop clinical strategies using nutraceuticals. Now, in part 2 of the course, when we go into the section on evaluation of infertility, and then in the section of clinical management, I'm going to show you step-by-step exactly how to work up a patient with infertility and how to use diet, nutrition, lifestyle in combination with nutraceuticals. But in this section, it's more about really showing you the science behind it and the theories behind it, so we can just focus on the step-by-step approach into clinical practice more in part 2 of the course. So when you look at nutraceuticals to support infertility, the way I like to look at it is looking into nutraceutical applications is to 3 main mechanisms. Nutraceuticals for fundamental mechanisms of fertility. These include essential fatty acids, blood sugar, nutraceuticals for blood sugar stability, nutraceuticals for hepatic biotransformation, nutraceuticals for the microbiome, and then specific nutraceutical considerations for infertility conditions, whether it's sperm dysfunction, PCOS, uterine fibroids, or endometriosis. And then just some specialized nutritional applications, whether we're looking at pituitary pathways or estrogen pathways or adrenal-based pathways. I'm going to start with the nutraceutical applications first. So and with these nutraceutical fundamental mechanism pathways first, there's 4 main pathways. This is what I always call the priorities when we're trying to balance the endocrine system. We have to have healthy hepatic biotransformation, we have to have healthy microbiome metabolism, healthy essential fatty acids, and healthy blood sugar stability. Let me go over these pathways first. When you look at hepatic biotransformation and microbiome metabolism, so what's really important to understand about how the endocrine system works is your endocrine glands, whether it's your ovaries or the testes or the thyroid, they produce a quantity of a specific hormone. And they just put this out there into the bloodstream. But the fine-tuning of which metabolite is converted and it's used, the degree of binding protein you have, the degree of which hormones get cleared and don't get cleared, the fine-tuning of endocrinology really takes place at the microbiome, and it really takes place through hepatic pathways. So when we're looking at fundamental mechanisms of fertility, we really want to make sure we have a healthy microbiome. And we'll go into some research of how the microbiome impacts endocrine metabolism. We really want to make sure the liver has the ability to biotransform and clear hormones and is healthy. So those are key pathways here. And what you see here is hormones going through hepatic and microbiome metabolism pathways, and they become metabolites and they impact endocrine signaling. So always think of the microbiome and hepatic pathways is a way to fine-tune the metabolism and conversion and the free fraction and protein bound states of hormones to some degree. So it's kind of like the fine-tuning filter of the endocrine system. And then if we get exposed to endocrine disruptors, we have to be able to metabolize those out. And if we can't metabolize them, they're going to continue to disrupt endocrine signaling. So the importance of hepatic biotransformation is really critical. And then the other key thing you'll see here is that there's information and feedback between hepatic pathways and the microbiome through vagal outputs back into the hypothalamic pituitary adrenal pathways, and then non-volitional gut peptide pathways where you have different gut signaling agents impact the feedback loop. Those are all part of normal endocrinology integration. And then we have essential fatty acids that we consume from our diet. They involve producing prostaglandins. Not all fatty acids have to be essential, but we'll talk about that in more detail in a second here. But fatty acids and healthy fats are really important to produce prostaglandins. Prostaglandins bind to prostaglandin receptors, which have a direct impact on endocrine signaling. That's very important for us. And then we have to have healthy blood sugar stability. And blood sugar stability makes ATP and controls cell and tissue responses, but dysglycemia really disrupts hormone pathways, whether it's PCOS or hypoglycemia. We know that those mechanisms take place. So, in many cases, when you look at infertility, you don't have PCOS, you don't have endometriosis, you don't have a known condition. You're just trying to improve patient's health and physiology to make sure that they can improve their overall physiological response and their overall fertility. One of the most important pathways in fertility management is fats and essential fatty acids. So when you look at fats, linoleic acid and alpha linoleic acid are essential fatty acids. And by that term, what that means is our body cannot synthesize these compounds, that we have to consume foods that have these sources in order to make prostaglandins. And things like canola oil, sunflower oil, grapeseed oil are things that make linoleic acid. And things like nuts, seeds, flaxseed oil make alpha or parts of or convert into alpha linoleic acid. And then these essential fatty acids then convert to other fatty acids, which then make prostaglandins. And prostaglandins are anti-inflammatory, like prostaglandins 1 and 3, or pro-inflammatory, like prostaglandin 2. And in general physiological responses, you actually have to have PG1, PG2, PG3 to some degree. The problem that we have is that we have a population with a Western standard diet where they have very high amounts of PG2, pro-inflammatory prostaglandins. So things like animal fat, butter, seafood produce prostaglandin 2, but it's not just that. Things like pathways through omega-6 pathways like linoleic acid, like vegetable oil or fried foods, they get shifted into the pro-inflammatory cascade. So if you look at things in the omega-6 pathway, they can either go anti-inflammatory PG1 or pro-inflammatory PG2. When you take vegetable oils, when you take high amounts of insulin responses that take place with people, you take fried foods, they convert the omega-6 pathway into a pro-inflammatory cascade. So most people that are walking around with a westernized diet have this pro-inflammatory prostaglandin elevation and not enough anti-inflammatory prostaglandins. And that leads to pelvic pain, really triggers endometriosis, causes a lot of inflammation in endometrial tissue because they're so sensitive to prostaglandins because they're loaded with prostaglandin receptors. So here you can see, for example, arachidonic acid is being synthesized, and then you have all these different prostaglandin receptors which are involved with creating an inflammatory response. And this equates to pelvic pain, systemic inflammation, and then altering hormone imbalances as well. Whenever you're looking at a dietary nutritional approach, if you're seeing pelvic pain, if you're seeing endometriosis, or you have any pattern of infertility, you want to go through your diet evaluation with them and see if they have categories of all of these different fatty acids. Omega-3 pathways, omega-9 pathways, omega-6 pathways, and then arachidonic acid. For people that have lots of inflammation, pelvic pain, endometriosis, this is really the pathway you need to avoid. You also need to make sure they avoid partially hydrogenated fats and vegetable oils, and then try to really increase the spectrum of these good fats and good oils. Some of these you can do with supplements like flaxseed oil, fish oil, blackcurrant seed oil, evening primrose oil. You can do all those with diet. Things like avocado oil, you would have to, let's say, have them included into their diet. Olive oil, they'd have to include in their diet. So you'd want to get a broad spectrum of these fatty acids. When it comes to healthy pregnancy, when it comes to supporting the fetus, reducing risk factors, you want to have a balance. Now you can have some people that come in, their diet's really high in fried foods, which raise arachidonic acid, and animal meats, and very high vegetable, fried food, animal meat diet, and they don't eat any fish. They don't have any healthy oils in their diet, and they'll be shifted into a pro-inflammatory cascade. So one of the first things you want to do from a nutraceutical approach is look at their diet and see how much omega-3, 6, and 9 is involved, and with a combination of things they use in their diet, like olive oil or avocado oil, and supplements like fish oils and flaxseed oils and borage oil, you want to try to balance these out. For ideal pregnancy, you want to get a diverse amount of fatty acids in a patient's diet as possible. For infertility, same thing. Now, most females, if you look at the studies on fatty acids, we talked about diet and lifestyle, they need both omega-6, omega-3, pathways, but most studies on male fertility shows that they have a higher need for omega-3s. But your patient's individual diet will be a factor. Now, for those that have low BMI, that don't eat fats and are always on healthy foods, they may not be getting enough arachidonic acid. So again, a vegetarian diet with lack of meat, fish, meat, eggs, butter, shellfish may not get enough arachidonic acid. And not having enough arachidonic acid throws off prostaglandin imbalances too. So the majority of people you'll see will have too much prostaglandins. Those will be your standard American diet individuals in your patients and your practices. PCOS patients, they need to really improve their omega-3s, for example, or increase their diversity. But for the fat phobic, many times vegetarian, they're not getting enough of arachidonic acid, and that has a major impact on the prostaglandin imbalances. So prostaglandins are involved with endocrine signaling, blood flow circulation, they protect tissues, and the shift in prostaglandins into a pro-inflammatory state will lead to pelvic cramping, pelvic pain, systemic inflammation, and mood changes. So we need to shift this balance back by looking at their diet, nutrition, and lifestyle. If we can change their prostaglandin levels, then we can definitely help with their pelvic blood flow and pelvic contractions and healthy immune function. The minute someone tells you they have pelvic pain, that they have pain with sex, that they have any kind of pelvic discomfort and it's made worse during their menstrual cycle, you pretty much know you have a prostaglandin imbalance. So then you want to go through their diet and figure out what areas you need to fill. And usually for these female patients that have these symptoms, you can start to see as you start to balance out their prostaglandins with essential fatty acids in their diet or supplemental essential fats, a combination of both, that you can pretty much get rid of their pelvic pain. It's really critical for sperm function as well. So lots of studies published on this. So let me show you some of these important studies. This was a title this is a study that was published, Effects of Altering Dietary Fatty Acid Composition on Prostaglandin Synthesis and Fertility. Conclusion: the preceding survey has established that changes in dietary polyunsaturated fatty acids composition can affect membrane phospholipid polyunsaturated fatty acid content and alter prostaglandin synthesis. It has illustrated the diverse and profound roles played by eicosanoids and general prostaglandins, particularly in reproduction and fertility. So this prostaglandin balance is absolutely critical. And in this paper, they go on to show that maternal preconception of polyunsaturated fatty acids, specifically omega-6 and linoleic acid intake, are associated with improved pregnancy rates in overweight and obese women undergoing IVF. This has implications for optimizing fertility through preconception nutrition. And then this other paper, which was a prospective study of 200 women undergoing IVF, found our work shows that increased omega-6 to omega-3 polyunsaturated fatty acid ratios in women undergoing IVF are associated with increased implantation and pregnancy rates. Prospective trials are needed to determine whether manipulation of polyunsaturated fatty acid ratios through diet and pharmacological prevention may be benefit for planning to conceive. So study after study really shows how important these fatty acids are in normal fertility mechanisms. The same thing has been found with men. In conclusion, infertile men had lower concentrations of omega-3 fatty acids than spermatozoa than fertile men. These results suggest that research should be performed to assess the potential benefits of omega-3 supplements as a therapeutic approach in infertile men with oligostanda teratizosperma, which is a condition with poor sperm movement, abnormal sperm shape, and low number of sperms. Basically everything that goes wrong with sperm. So fatty acids have been shown to have an effect there. Now, in this paper titled Polyunsaturated Fatty Acids in Male and Female Reproduction, they found that polyunsaturated fatty acids can affect reproductive processes, but appears to be a two-edged sword. Some essential, but too many are potentially harmful. And ultimately, the key thing is that there's balance. So whenever you see a patient that has infertility, you immediately need to do a dietary history of their fats, good and bad fats, and figure out where in this cascade you need to add some things in. Someone comes into your practice and they say, I hate fish and I don't like nuts and seeds, are too fattening. You know their omega-3 pathways are involved. If someone is consuming a lot of animal fat, butter, and fried foods, you know the PG2 pathways is totally inflammatory. So you want to go through this list, play around with different oils and fatty acids to get that stable. So that is one of the most essential things you can do, if not in the top 5, maybe in the top 1 or 2 mechanisms that are involved with really balancing out essential fatty acid pathways. Another key thing from dietary and nutritional point of view is really making sure the blood sugar levels are stable, adrenal glands are functioning well. And one of the things we talked about is making sure that we determine if any of our patients have blood sugar issues in the dysglycemia course by asking the patient in history, do you experience any change in your energy and function after you eat? So any changes in energy and function after you eat indicate dysglycemia, and you may have more effects supporting their dysglycemia pattern with nutrition than you would do anything directly for their infertility. So remember that a normal response after someone eats is there's no fatigue or change in energy levels after they eat. But if they feel energized and feel like they're functioning again, that's a sign that hypoglycemia, that's being something that their blood sugar levels are being normalized. And then if they get tired after they eat, that's a sign that they have insulin resistance. So one of the things you want to immediately do from a nutraceutical model when you have patients with infertility, besides figuring out what's happening with their fatty acids, is to see if they have a blood sugar issue. And again, the question asked is, how do you feel after you eat? The ideal response is no change. Now, for patients that have hypoglycemia, the typical thing you'll find with them that they feel better after they eat, and they have a lifestyle where they miss meals, avoid snacks, eat high sugary snacks, use caffeine or nicotine to suppress their appetite. They have sweets instead of a meal. They have long gaps of fasting between dinner and the first meal. They have lack of protein or fiber in their diet. Overtraining without replenishing glucose. These are all lifestyle factors that cause hypoglycemia. Then they get shaky, lightheaded, irritable, lightheaded, blurred vision, can't function with blood sugar levels low. Then they eat and they feel better. And one of the things that they'll come in with, besides any of these other symptoms here, is infertility. So fatigue, insomnia, mood disorders, those are all signs of blood sugar issues. And in the hypoglycemia course, we talked about the most important supplements for hypoglycemics. So brain chain amino acids, isoleucine, valine, these can immediately be metabolized through gluconeogenesis into getting blood sugar levels back up. Plant sterols, fibers can all stabilize blood sugar levels. Polyphenols can have a huge impact on blood sugar stability. So with patients that are hypoglycemic, it's really important for them to not miss meals and eat frequently enough so they don't feel like their function's coming back in between meals, that they're eating frequently enough so they don't notice any shakiness, lightheaded, irritability. And if their blood sugar finally gets stable, what they're going to notice is that when they eat, they don't feel like they're functioning normal again. They're just not hungry. And after a few days of stabilizing blood sugar levels, they usually start to notice their appetite again. So the most important nutraceuticals for hypoglycemics are adaptogens. I'll give you a list of these in another slide. B vitamins, fiber, plant sterols, plant chain amino acids. So these are things we talked about in the dysglycemia course for the Carnegie Institute, but these are really important nutraceuticals. Now, I want you to notice that when I'm talking about this application of nutraceuticals for infertility, I'm not jumping to a bunch of herbs that have fertility factor responses. I'm trying to impact the web that has impacts on many downstream effects of fertility. Fatty acids is one of the most important ones. Blood sugar stability is another one. So a lot of times just fixing a patient's, do you have a patient come in, they're underweight, they're hypoglycemic, they miss meals. You have them increase their caloric intake, get their body fat a little bit up, stop overtraining, start to get their hypoglycemia under control, start getting some good fats in the diet, boom, 2 months later, they don't have infertility anymore. Sometimes it's that simple. So the other group of dysglycemia you have to make sure you're worried about and know what to look for is those that have insulin resistance. This is the pathway for PCOS. With insulin resistance mechanisms, the key thing you notice them is they have fatigue after meals. They get really tired, their blood sugar levels are elevated, they may have obesity, but lack of physical activity, overeating, high sugar, starch and carb diets, these all impact insulin pathways, and infertility can develop from these pathways as well. Now, there is a complex understanding of insulin signaling pathways with AMPK, sirtuins, the gut pathways with GLP-1 and GIP, and G-coupled proteins and toll-like receptors and farnesyltransferase index receptors we talked about in the diabetes course, but we don't have time to get into all those things. But the most important nutraceuticals to manage insulin resistance would be resveratrol, berberine, short-chain fatty acids, glutathione, gymnasium, EPA, DHA, fiber supplements, and B vitamins. Of all these, I would say maybe resveratrol and berberine could be the two most important ones. For some people, they have to For some people, honestly, you'll find they have PCOS and you put this course away and jump into the diabetes, insulin, dysglycemia course we taught and really unwind their diabetes, dysglycemia that way to resolve the fertility. But since we can't teach 2 courses in one weekend, all I can show you is this link that PCOS is involved with insulin resistance. If you really go into the strategies we talked about in the diabetes course, that would be the most effective way to unwind PCOS patterns. Now, the other key thing that's important when you look at nutraceuticals for infertility is the biotransformation pathways. So remember that chemicals have to go to phase 1 and phase 2B and to be cleared out of the body, but also hormones are metabolized through different metabolites through the liver pathways, and you need specifically phase 1 and phase 2 nutraceuticals to support things like methylation, glucuronidation, sulfation, acetylation, glutathione conjugation, and antioxidants to impact the cytochrome P450 pathways. These are all summarized in a list of these individual ingredients. Now, in a real clinical model, you're not going to have a patient pick up 25 different supplements to support the biotransformation pathways. Most nutritional manufacturers have powders and different formulas and drinks that have a combination of these things in there. But these are the most commonly used nutraceuticals to impact phase 1, phase 2 pathways. So for some patients, as you're dealing with infertility, if you think they've been exposed to a lot of endocrine disruptors, if you think that they may have been exposed to a lot of pollutants, or maybe even for the first 6 weeks or month, you really want to optimize your biotransformation pathways, you may want to put them on a nutraceutical that has all the different things in there to support the phase 1 and phase 2 pathways. And then another part of infertility management from nutraceuticals is really to make sure that their microbiome is healthy and working. So hormones come in, they interact with the microbiome. The microbiome has bacteria which have enzymes, and these enzymes and bacteria can metabolize hormones for elimination. They can convert hormones to active metabolites. They can synthesize gut peptides to modulate the endocrine system, and they can help regulate blood sugar stability as well. So the microbiome is very active. The microbiome, people think of gut and they immediately think of absorption, but the actual bacteria in the gut are involved with many physiological processes of the human body, and the more diverse the microbiome is, the more efficient the endocrine system is, the immune system is. And when you're looking at the subtle infertility, unexplained infertility, you can't overlook how important it is to optimize the microbiome. This was a study that was published titled Microbiota and Human Reproduction, the Case of Male Infertility. They go on to show that indeed microbes have been reported to play a role in several diseases, including infertility. In particular, the male seminal microbiota has been suggested as an important factor able to influence couples' health and pregnancy outcomes as well as offspring health. And they go on to show that when you're really looking at the gut has different enzymes like beta-glucuronidase. It has factors on the cell surface that all have an impact of getting into circulation and then impacting vaginal epithelium and even the peritoneal fluid in the uterine cavity, changing pH, changing fluid dynamics, changing immune function in the uterus and in the vagina that are involved with normal fertility responses. So we know that there's a direct connection between the pH and physiological function and the inflammatory mediators and growth factors in the reproductive tissues that really take place secondary to the gut. We also know that endometriosis, especially ectopic endometriosis, can really be impacted by inflammatory bowel diseases and celiac diseases and any type of inflammatory interaction driven by the gastrointestinal tract. Now, in this diagram here, you see all the most common conditions involved with infertility: endometriosis, PCOS, metabolic syndrome. They even list cancer and brain function here, but we're more concerned about these ones in this course. And they show that gut dysbiosis, defined by decreased microbial diversity, abnormal, healthy versus good bacteria, and something called the estrobolome dysfunction has an impact on this gut. So the estrobolome is a series of bacteria in the gut that regulate estrogen metabolism. So there's an entire field of researchers just studying how gut bacteria regulate estrogens and the impact they have on infertility. And the science is amazing. But they show that you have to have a diverse gut bacteria environment. And the way you have a diverse gut bacteria environment is a diet rich in diverse fibers to then impact the estrobolome, to then modulate estrogen receptors, estrogen functions that then impact infertility. So there's lots of direct connections between the gut. The title of this paper was Estrogen Gut Microbiome, Physiological and Clinical Applications. If you want to read more about them in detail, you can check out that paper in your course notes. And what they find is also that the bacteria that colonize the gut have an impact on pH, again, the vagina, the cervix, the fallopian tubes, and the healthier the gut microbiome is, the healthier these reproductive tissues are in a female. So that's very important. And even more so, they've done studies where they look at the microbiome of human reproduction with patients that have undergone IVF therapy. And with IVF therapy, when there is when there is more microbiome alterations and dysbiotic patterns, there's lower implantation rates, increased number of miscarriages, decreased number of term pregnancies, and reduction in pregnancy. This was a review paper that cited multiple papers. And if the microbiome was healthy and healthy amounts of good bacteria and they're diverse, then the IVF outcomes are better. So we know that supporting the microbiome is an overlooked and really important part of human physiology. The most important nutrients for microbiome diversity, microbiome health, are short-chain fatty acids, butyrate propionate acetate, and then diverse fibers. So these are supplements you can use. And then lifestyle strategies are diverse list of vegetables, fruits, and fibers, diverse meals, sleep, normal consistent circadian rhythms, meaning you sleep at the same time every day, exercise, outdoor activities, interaction with pets. These all improve the microbiome. Things that limit the microbiome: limited diversity in the diet, eating the same meal every day, living in extremely sterile conditions, urbanization, lack of sleep, disruption in circadian rhythms, sedentary lifestyle, lack of exercise, antibiotics and NSAID use, pesticides, artificial sweeteners. These all decrease the microbiome. So those are the key things that you really want to look into. So the first place I start when I look at nutraceutical support for patients that have infertility is to look at their fatty acid intake, factors associated with blood sugar instability, factors involved with biotransformation, their microbiome health, and getting those in an optimal level first. So, and this is even more so with patients that have unexplained infertility. Now, if I have a patient that walks in with PCOS or sperm dysfunction, my protocol may be different, but at some point in their management, these things can get involved. And I think if you're going through the course, you're hearing all these different strategies, different protocols, and you know how to massage it into place and how to do the clinical approach. We'll get into that more in the management section, but I just want you to understand these concepts. So fatty acids are involved with prostaglandins, critical for male sperm function, critical for female reproductive function. Blood sugar stability is critical for things like PCOS and things that impact ovulatory dysfunctional pathways, biotransformation of the gut, and microbiome modulation are all critical for fine-tuning hormone interaction, hormone functions. So those are areas that I seem to like to work with first before I dive into specific protocols. Now, for people that have very clear conditions of their infertility, you may dive right into applications. For example, if they have sperm dysfunction or PCOS or uterine fibers, endometriosis. Let me show you the literature on some of these things so you also know what's been published on them and how to support them as well. So let's talk about sperm health first. So I'll go through all the research and I have a sheet at the end of this slides section that shows you a protocol to use based on the current evidence for optimizing sperm with antioxidants, nutrients, and minerals and so forth that have been published. So vitamin D is a major supporter of these pathways in testicular function. So vitamin D has beneficial effects in semen quality, modulates the testes. That's really important for spermatogenesis. In this study that was published, The Role of Vitamin D in Male Fertility, they did a very comprehensive review of how vitamin D impacts Sertoli cells, how it impacts the communication between hormone synthesis and how sperm is formed, the importance of vitamin D receptors, and then how those things impact the Leydig cells and output of testosterone as well. So basically every major pathway of testicular production of sperm and testosterone requires vitamin D. So vitamin D is an absolute must when it comes to male fertility and sperm. So if you ever measure vitamin D and you see it low with a male that has infertility or sperm issues, you definitely want to increase it. Now, in this paper, they also go in there and show in animals and humans what vitamin D has been shown to do impact testicular function. And for the most part, it's been shown to increase sperm motility, sperm count as the main effect. So vitamin D is really critical, especially when you see low motility issues or low sperm counts. Now, there's also studies that looked at semen quality of vitamin D. This is a review paper called The Role of Vitamin D on Male Fertility, focused on the testes, that was published. And these researchers went through in this review paper and they looked at subjects, whether they were healthy subjects or had infertility, and they wanted to know what vitamin D did. And for the most part, they found that these studies showed sperm count improvements, sperm motility changes, and changes in sperm morphology. So vitamin D is something you definitely don't want to ignore with sperm issues in male infertility. There was another paper that was published in Nutrients just recently in 2020, and the title of the paper was Dietary Supplements for Male Infertility, a Critical Evaluation of Their Composition. And it just reviewed all the major papers published on micronutrients for sperm production. Zinc, selenium, B12, alpha-lipoic acid, L-carnitine, NAC, coenzyme Q10, myoinosol, alpha-tocopherol, fish oils, and so forth. So this is a review paper in your notes, but it lists the basic micronutrients and flavonoids that have been shown to help sperm. I have those listed on the protocol at the very end. Now, in this paper that was titled Antioxidant of Sperm DNA Damage, these researchers explain how important it is to really have antioxidants to reduce sperm DNA damage and reduce DNA fragmentation. Now remember, when males get DNA fragmentation, that disrupts the embryo and leads to miscarriage. So dietary antioxidants can play a big role. So you get vitamin D, essential minerals, antioxidants are the main players when you're trying to improve sperm health. Whether you're trying to improve sperm health because someone has an abnormal sperm analysis profile, or you're just trying to optimize their health before the couple tries to have pregnancy, antioxidants become very important. This was a paper where they looked at one specific antioxidant, luteolin. Luteolin is the antioxidant that's found like in the skin of tomatoes, as an example. Very high amounts of luteolin. Lutein's found in celery. But this antioxidant was shown to dramatically impact inflammation caused by oxidative stress in the testes. And what it was shown to do in this pathway is turn on NRF2 pathways, which increase glutathione protective pathways to protect Sertoli cells that produce sperm. It was also shown to protect tight junctions, so there was no disruption in sperm production. So when you have chemicals and oxidative stress that end up causing impairment in healthy sperm synthesis, the first thing that goes are the blood-testes barriers. Once the blood-testes barriers are broken down, then free radicals get into the tissue and they directly get into Sertoli cells and they disrupt that. What they're able to show in the study is that taking luteolin blocked these adverse effects and had a protective effect. So this is what antioxidants do for males. Other antioxidants that have been shown and published to impact semen: vitamin E, vitamin C, carnitine, glutathione, CoQ10. Now, there was a very thorough meta-analysis conducted in 2018. It was a meta-analysis of randomized clinical trials where they're looking at the PubMed database, the effects of nutrient dietary supplements on sperm quality parameters. In the total, 28 articles were included, a qualitative analysis, 15 for the quantitative meta-analysis. So they looked at different factors as a composite score to see what the researchers have all found when they look at these clinical trials. So first thing was with selenium. So selenium, remember, anything that crosses the line means that it was statistically significant, that it had some type of impact. If it goes to the right, it favors using selenium. So selenium was shown to improve sperm concentration, improve sperm motility, and improve sperm morphology. So these are all favorable when you look at trials published. They studied trials published on zinc. Zinc didn't seem to have a major influence on concentration, but had impacts on motility and not so much on morphology. They looked at L-carnitine. L-carnitine, no real impact on concentration, some major impact on motility, significant impact on, they had used progressive motility and also total motility, and zinc was beneficial, and also on morphology. CoQ10, again, all across seems to have impacts on sperm count, and also we can see some changes in concentrations and motility. So each of these nutrients seem to have an impact. The most significant impact of nutrients published in these trials was, without question, omega-3 fatty acids, fish oils. So omega-3 fatty acids have a dramatic impact in all aspects of sperm function besides morphology, but 2 of the 3 trials really showed significant impacts. But this one trial was large enough and showed no effect. But overall, EPAs have a significant composite score impact in every single part of this response. So we know that it's really critical for men that are dealing with infertility issues and sperm issues to really increase their fatty acid intake. Omega-3 pathways seem to be the most important pathways. And they really help with differentiation and the development of healthy processes. When you look at the cell membrane of sperm, it's a combination of omega-6 and omega-3 fatty acids. And these are really critical for healthy sperm development. And when you look at dietary regimens, you really want to make sure that, with males especially, that they have high amounts of EPA, DHA, this omega-3 pathways, and reduced amounts of arachidonic acid, which come from fried food and butter and so forth. In males, you typically need to reduce your arachidonic acid and improve fish oils. From your fat-phobic vegetarian patient or something like that, people that just don't eat dietary fats, you may have to increase their arachidonic acid and have them eat butter and have them eat ghee and have them eat shellfish to really raise these arachidonic acid levels. And maybe even have fried vegetables to really raise their arachidonic acid to some degree. But for most men that are out there, you really need to increase their EPA, DHA levels and reduce arachidonic acid. Now, this was a paper that was published called The Effect of Omega-3 Fatty Acids, EPA, and DHA on Male Infertility, a systemic review and meta-analysis. So they looked at only RCTs of humans, and the meta-analysis indicated that supplementing infertile men with omega-3 fatty acids resulted in significant improvement in sperm motility and concentration of DHA and seminal plasma. So again, sperm concentration, motility levels significantly changed. The actual content of DHA in the sperm and seminal fluid didn't change much, but the actual motility and concentration was pretty significant. And this was a PRISMA review of cysteine studies, systematic review. They found this, based on finding this review, omega-3 supplements and diet intake of omega-3 might improve semen quality parameters in infertile men and women. So this is the point. When you're looking at evidence-based medicine, you cannot deny the fact that essential fatty acids are absolutely critical for healthy sperm function. Antioxidants are really critical, and micronutrients can have a huge impact on sperm function. So this is a list. These are, and there's botanicals, tribulus has been shown to have some impacts on male fertility as well. So antioxidants, nutrients, and other nutraceuticals. So this would be a cocktail if you're trying to improve general function for a male to optimize their sperm. So you can print this out, you can hand this out. If you're going to remove one just to reduce the load, I would say you don't have to use tribulus with everyone. Tribulus has some impacts stimulating LH to help produce testosterone, which can be impactful. But all these antioxidants and individual compounds, like a lot of these, like this amount of zinc, folic acid, B12, vitamin C, you can get in a multi. These you may have to take individually. And then fatty acids would be important. So if you have, like, let's say, for example, a male that has an abnormal semen analysis, you can put a protocol like this in place with some dietary lifestyle change. And then 3 months later, we do a sperm analysis to see if it's improved. If it's improved, you really made a significant impact on the systems. But those are the main things. If you had to limit Just a couple things to really help with males. I would say for sure take a multivitamin if that hasn't already been done, but omega-3 fatty acids and glutathione would be your most impactful nutrients if you're dealing with the limitation of how many supplements you can give to the patient. So those are the things with sperm. Now let's talk about nutraceuticals for PCOS. So as we know, PCOS is an insulin-related issue. One of the key things that's been shown in studies, this was a review of 9 studies where they looked at PCOS, was myo-inositol. In this article, after reviewing the relevant literature, we can conclude that myo-inositol, an insulin sensitizing agent, has a role in improving quality, not quantity, quality of embryos in women with PCOS who undergo various assisted reproductive procedures. So when they take women that have PCOS and they extract their eggs, most of those eggs just do not have healthy quality and they have bad embryos. They found that when they used myo-inositol, they would have a better embryo with these women that had PCOS. It's because it enhances insulin requirements. The androgen response that takes place with polycystic ovaries increases the size of the follicles. They get multiple follicles and enlarges these eggs, but they're inflamed and not healthy. And myo-inositol has been shown to help with those pathways. And they go on and show that myo-inositol is a signaling messenger pathway. It helps regulate TSH in addition to insulin and FSH signaling. So it's a very important messenger compound that's also an antioxidant. Now, this study looked at the therapeutic effects of mechanism herbal medicines for treating PCOS. They looked at a total of 27 studies, 20 different herbal medicines that helped support PCOS. And they found that herbal medicines were able to normalize female hormones, diminish male hormones, recover estrous cycles, ameliorate insulin resistance, improve lipid metabolism, PCOS, all the things you really want. And there's a list of them all here in this paper that you have in your notes. However, with that question, there's one botanical that is more effective than any other one that repeatedly shows effect, and that's berberine. So this was a study which was a clinical study on the short-term effect of berberine in comparison to metformin on metabolic characteristics of women with PCOS. Now, berberine and metformin are both AMPK modulators. AMPK is a pathway that's involved with insulin signaling. So what they're able to do is really do a study with individuals that had PCOS, women that had PCOS in their study. They had 3 groups. They had 31 women that were taking berberine. They were also taking CPA, which is, CA, which is cryptopyrin acetate. It's like an androgen blocker. They had to give each group an androgen blocker because of ethical reviews. They had to give them standard treatment. But with one group, they gave them the conventional androgen blocker with berberine. Another group, they gave them metformin with the androgen blocker, and one group was a placebo. And for the most part, when you look at the outcome, the one that had the ECSS, statistically significant outcomes, for changing all the parameters of PCOS, whether it's insulin control or changes in lipid panels or changes in factors that are impacted with infertility, it was the berberine in comparison to metformin and the placebo. So conclusion, intake of berberine improved the metabolic and hormonal derangements in groups treated with Chinese women with PCOS. Main effects could be related to changes by body composition, obesity, dyslipidemia. Further controlled studies are needed for the assessment of potential favorable metabolic effects of berberine in women with PCOS. So berberine is really the most important botanical when you're looking at PCOS. They did another study. This is a trial. They looked at the use of berberine for women with PCOS syndrome undergoing IVF treatment. And one group of 50 subjects got berberine before IVF, 50 people got metformin, 50 got a placebo. And they evaluate them at 12 weeks and then at the end of the study. And then what they found was berberine and metformin treatment prior to IVF improved the pregnancy outcome by normalizing clinical endocrine and metabolic parameters in PCOS women. Berberine has a more pronounced therapeutic effect and achieved more live births with fewer side effects than metformin. So it's showed to be as effective with fewer side effects than metformin. So again, this is profound research that you can see how impactful berberine is. This was another paper that was done. It was PCOS Management Review of Possible Amazing Role of Berberine. It was a systematic review of randomized clinical trials for the past 18 years done in humans with a sample size of 1,788 women that were done in this composite score evaluation. Here's what they found. Two authors found out that berberine induced the redistribution of adipose tissue, reducing that in the absence of weight loss and improved insulin sensitivity. One author demonstrated that berberine improved the lipid patterns. Moreover, three authors demonstrated that berberine improved insulin resistance to thecal cells. This is where PCOS takes place. With the improvement of ovulation rate per cycle. So berberine is effective for fertility and live birth rates. Again, these are randomized clinical trials in humans. Conclusion. Finally, berberine is safe to use in premenopausal women who want to get pregnant and showed few side effects in all cited studies. In conclusion, the use of berberine for PCOS is safe and promising, even if more studies are needed to create consensus about the dosage of berberine useful for long-term therapy. But overall, it seems to be very safe and really impact outcomes with PCOS. Then they also found the combination in human RCTs. This was the human RCT with 34 patients for a 12-week study. Things like alpha-lipoic acid and myo-inositol were very important in helping patients with PCOS. You can see some of the outcomes in this study where you can see significant changes in the group that was treated with those nutraceuticals. And several papers have been published in myo-inositol and studies where they compared metformin to things like alpha-lipoic acid and inositol show that things like alpha-lipoic acid are very helpful with menstrual patterns, with ovulation and insulin resistance, and same with alpha-lipoic acids. So we know that berberine impacts AMPK, inositol impacts insulin receptor, myo-inositol impacts insulin receptor site responses, and this is a typical protocol with the exact dosages, minimal dosages, or useful, or I say clinical dosages, you could say, that could be used to impact PCOS. Berberine, Rosebud, Burdock, Genimia sylvestre, these are all AMPK stimulators. Resveratrol, curcumin, liposomal glutathione, these help deal with the anti-inflammatory load involved with PCOS. And then these other nutraceuticals are also involved with the insulin signaling pathways that are involved with PCOS. So this is the nutraceutical protocol I would suggest for patients that have PCOS based on published literature. Now, let's talk about fibroids. Fibroids, if you remember, have a very strong genetic influence that they're not really promoted much. They're not really promoted as much with diet and nutrition as they are with just genetic mechanisms. And the myometrial stem cell can convert into a uterine fibroid cell and then promote these different fibroids. And hormones like progesterone and estrogen impact fibroids and fibroid tissue, then are increasingly sensitive to estrogen and progesterone, and then they increase the size of the pelvic cavity, and then these uterine fibroids can also release inflammatory mediators, which may impact implantation, especially if it's submucosal fibroids. And in this paper that was published, The Evolving Role of Natural Compounds in the Medical Treatment of Uterine Fibroids, they talked about, what has a lot of potential based on mechanism is vitamin D, EGCG, which is the main component of green tea, and then fruits and vegetables, anti-inflammatory diet, and several medications. And the summary of this was basically, this was just a theoretical paper. And to be quite honest, there's not a lot of good research on nutraceuticals to support fibroids. There's only a few listed papers, and these are the ones I'm showing you. So green tea and vitamin D could be promising, and then resveratrol could also be promising. Now, here's what they state in the paper. Vitamin D and green tea extract might be optimal in such cases, meaning uterine fibroids. Recent attempts to create a new, cheap, safe, and effective drug for treatment of uterine fibroids remains in the very early stages, and their success has not been determined. And what they're saying in this paper is, in a conventional approach, even with using pharmaceuticals, we don't have much success with uterine fibroids. And if we might want to look at combination therapies and things that are safe to use, which may have some benefits, could be vitamin D, and green tea. Now, there was a study that was published that looked at micronutrient concentrations and risk of uterine fibroids, and they did a cross-sectional analysis of 807 women ages 20 to 49 who were participating in the National Health and Nutrition Examination Survey. They measured their serum micronutrient levels, and they wanted to see if there's any changes in their micronutrient levels for the women that had uterine fibroids. And what they found was results, statistically significant dose-response relationship observed between vitamin A and uterine fibroids after they adjusted for age, race, everything else. And maybe a little response with vitamin C, but really nothing else. They don't really find micronutrients to be a direct factor with uterine fibroids. So you probably wouldn't expect to see much change with nutraceuticals for that. And then the author's conclusion, current evidence does not support or refute the use of herbal preparations for the treatment of uterine fibroids due to insufficient studies with large sample sizes and high quality. Further high quality trials involving evaluating clinical relevant outcomes are warranted. And that's the key point with fibroids. And these people that completed this Cochrane review, which is such a well-done review, really found there just isn't enough research to really support anything helps or doesn't help. And that's one of the problems we have with uterine fibroids. And we look at nature and we look at research. The studies, the suggestions for vitamin D and green tea were just based on mechanism. Those weren't clinical trials. So we don't really know what really makes a big difference for uterine fibroids from a nutraceutical model. There's been some studies in vitro and in mice with resveratrol. So in this study, they looked at controls. You can see the arrows pointing to the uterine fibroids. And then they gave them resveratrol. They can see the size of those fibroids going down in this mice study. They looked at the size of the fibroids. And then with resveratrol, they could see a big change. So they could see some changes in a mice study with resveratrol, and they could see some in vitro changes with mice in this study. But that's with mice. That hasn't been done in a human clinical trial. But then again, resveratrol is anti-inflammatory, has lots of health benefits. If you do have a fibroid, patient has a fibroid, you might say there's some mice studies that show to help, but that's about it. But it doesn't hurt. It could be beneficial to you for other ways. And then there's what's been published in the literature is, and very popular in Chinese medicine, is Guzi Fuling formula. Guzi Fuling formula appears to have additional benefits based on methpestrine treatment and reducing volume of fibroids. However, due to high risk of bias of trials, we would not draw a confirmative conclusion on its benefits. Future clinical trials should be well designed to avoid these issues that are identified in the study. And this formula is a combination of these herbs. So this is very popular in Chinese medicine, but when you look at the review, the studies suck. They're terrible. To be quite honest with you, I don't know how they got published. And to even be more honest, they got published in second-rate journals in, let's just say, a different language. So, it is what it is. Now, when you're looking at fibroids, there was a human randomized clinical control study done with a small group with 33 symptomatic patients that actually found that green tea, EGCG of green tea, shows promise of safe and effective therapeutic agent for women with symptoms of uterine fibroids. And it's easy administered. And the symptoms is basically pelvic pain, especially during their menstrual cycle, and cramping and pain with sex, the typical things of fibroids. And they showed in a small study of 33 human subjects that it had somewhat of a benefit. But it doesn't shrink the fibroids. It was just to get rid of the symptoms. They didn't measure any change of size change. We don't know if that takes place with any nutraceutical supplement. And this was a review of the literature where they looked at vitamin D, and they looked at the promising effects of vitamin D on uterine fibroids, and again, may have potential. So vitamin D, resveratrol, green tea, vitamin D, resveratrol are the only things you can come up with if you do extensive literature review for fibroids that's been published, but the evidence is not that great. But also these things are not harmful, and for most people, taking green tea, vitamin D, resveratrol has lots of antioxidant benefits and health benefits. So if someone's trying to control their fibroid growth, this may be a good option, but you wouldn't expect to have a patient taking these nutraceuticals and see their fibroid size change. So that's what you need to know about that. Then finally, we get to endometriosis. And with endometriosis, we have this inflammatory cascade, this inflammatory pathway that's involved. And if we look at the different studies with uterine fibroids, with endometriosis, we know that basically antioxidants and antioxidants and folate and B6, B12, vitamin D, glutathione have all shown to have some benefits in dampening endometriosis-based inflammation. Vitamin D has been really shown to dampen the inflammatory response in endometriosis. Studies have been published where they, like this Nurse Health study between 1991 and 2005, where they looked at cases, they found a statistically significant relationship between intakes of thiamine, folate, vitamin C, vitamin E from food sources that had a beneficial effect on endometriosis, or I should say inverse relationship between developing endometriosis. And when you look at endometriosis, remember that it's peritoneal fluid that's turning on these endometrial cells to develop into endometrial scarring and inflammatory tissue. So here you can see that these inflammatory cytokines in peritoneal tissue turn on COX-2, which activates the prostaglandin 2 pathway, which is the arachidonic acid pathway. They can have a significant impact on endometriosis development. So COX-2, activated by prostaglandin 2, really turns on the inflammatory response that leads to endometrial-induced dysmenorrhea and infertility. And let me just skip here. These are just inflammatory pathways with endometriosis. And here what you're seeing is just exactly what we talked about. You have endometrial tissue. This is retrograde menstruation. It comes out of the peritoneal cavity. The peritoneal fluid is very active in prostaglandin 2, which comes from arachidonic acid. Prostaglandin 2 with arachidonic acid activates these tissue cells and promotes endometrial scarring. And this leads to significant pelvic pain with people that have endometriosis. That's why once you figure out the prostaglandin imbalance with people that have endometriosis, it's a game changer. It has a very profound impact on them. So here we go, PGE2, prostaglandins turn on eutopic within the uterus and ectopic outside the uterus responses. And there's been some studies. One was published on glycyrrhiza. Glycyrrhiza has an effect of protecting leaky gut-induced inflammatory responses in the endometrium. Vitamin D has been shown to deal with the pain and severe pain of women that have endometriosis between ages 80 and 45. There's a list of products in this review paper: curcumin, anti-inflammatory compounds like omega-3 fatty acids, vitamin D, datazine, genistein have all been shown to have some effects. One of the most powerful ones is curcumin. That seems to have a major impact on the inflammatory response. Resveratrol also, again, shows to have some promising effects. And this is the protocol that I would consider if you were trying to support the endometrium. Figure out fatty acid balance. These are just a diverse list, but it may be specific when you do their dietary history. Load up on antioxidants, and then some basic A, D, E, K, fat-soluble nutrients, and B vitamins. Those are all critical for dampening endometrial inflammation. Now, I have fatty acid balance here. I've listed some supplements, but the key thing is to look through their diet and figure out which fatty acids are involved, so you can really give them a diverse source of oils in their diet that they mix with their salads, and also some supplements that they take. So those are the main nutraceutical uses for each of these conditions. And then just a few other pathways I just want to talk to you about for specialized responses here. And when you're looking at supporting the pituitary, like if you have a low FSH or LH pattern, you should know that things like tribulus in females increase FSH, which can be helpful for some follicular phase activity and low estradiol. And tribulus in males, however, increases LH and testosterone. And these are on small studies, nothing significant, but this is what appears to be happening with this botanical. And with Vitex, similar things. Not a lot of significant research, but what appears to be happening with Vitex chasteberry is in females, it increases LH, which is very good for getting progesterone activity supported. And in males, Vitex suppresses LH, which decreases testosterone. Monks that had to deal with their libido issues used to chew on chasteberry to shut down their libido. So in men, chasteberry suppresses LH and their testosterone levels. So it has this anti-androgenic effect. In females, it has a major effect on increasing their LH, so opposite effects in males versus females to improve their progesterone levels. So that's pretty interesting. And then the other key thing to take into place is support the pituitary stress responses, dampen FSH and LH output. So adaptogens like ashwagandha, holy basil extract, rhodiola could be useful to support these pathways. Now, nutraceuticals support estrogen metabolism. Most common cause of this is someone's been on birth control pills and they need to get off and they want to clear out their estrogen metabolites or something. Estrogen metabolites are cleared out through methylation pathways, glucuronidation pathways, and sulfation pathways. I put together a protocol to help support estrogen pathways. If you want to get FSH up, you can consider Tribulus. If you want to use a selective estrogen receptor modulator, so this can increase or decrease estrogen receptor sites based on what the body needs. Genistein, diazine, black cohosh, non-qui can be used. If you're trying to increase and shift metabolites of estrogens, to have estrogens have a protective effect, this is where things like indole-3-carbinol or DIM come in. And then if you want to support liver biotransformation pathways, B12, folate, trimethylglycine, choline can be used. And then lastly, for adrenal support, to deal with stress responses, these are the list of adaptogens. My favorite ones are listed as 5 stars. This is based on personal opinion, not on the research. And in summary, when you're looking at nutraceutical supports, you want to look at things that impact fertility mechanisms like the microbiome, blood sugar balances, biotransformation, and fatty acids. And then I gave you a sheet for each of these conditions with the application to dosages for sperm, PCOS, uterine fibroid issues, endometriosis, and then we just went over some of the ways to support these pathways as well. I'll combine these two in a clinical approach, but those are the main background information and studies on nutraceuticals that directly impact fertility.